How healthy are people living in Kent County? New numbers just out today have health officials paying close attention to West Michigan's health. And tonight, Teresa Branson, the Deputy Health Officer for Kent County Health Department, here to break down these numbers for us and what they mean. Thanks for coming in tonight. We appreciate it. What are the criteria in which these rankings are assessed?
Well, the criteria looks at several different factors. They look at health outcomes, they look at health behaviors, they also look at social and economic factors. So it's not just related to specific health outcomes, but other factors related to social and economic health as well.
So Kent County came in 16th. That was the same as last year, but there are still troubling items out there. Obesity, one of them. Kids living in poverty, too. What concerns you about those particular numbers?
Yes, well, as you said, we're holding at 16th. That's where we were last year with the county health rankings. So we're happy that we haven't gone down in those health rankings, but pleased to know that there are things that we can always do to improve. Looking at the childhood poverty level, that 23% of children in Kent County are living in poverty. Kids count data earlier in the year indicated that 48% of kids are qualified for free or reduced lunch. So I think, in our community, one of the things that's going on is we're resource rich here. So I think just educating families on how to take advantage of different resources that we have available, whether it's food pantries or, in our schools, ensuring that kids have access to breakfast, because we know that, kids are going to be able to focus more if they have.
Absolutely.
If they don't have to worry
Nutrition.
about that. Right.
Mm-hmm. Ottawa County, right next door, was #1 in the state. Is that an apples-to-apples comparison, or are there a lot of other factors going into this?
Yeah, there's definitely a lot of other factors going into this. And, Ottawa County was ranked right at the top there. But when you look at the population size, so Kent County being right at about 600,000 population here in Kent County, Ottawa County being a lot smaller, I think around about 230,000 population there. So when you're in a larger metropolitan urban area, we're certainly going to see more types of health indicators, more types of issues that people are faced with daily, more social and economic factors based on where people live and the impact that that has on their health.
Sure, and that's the whole thing. We're not just looking at particular health issues here, but a whole wide range, a whole spectrum of lifestyle issues really in this area.
Yes, and one of the things that we want to promote, like through the county health rankings, is yes, there are some things that individuals can do to have a better, healthier lifestyle, but a lot of times we want to look at place because we feel that place matters. So one of the health indicators in the county health rankings was related to the physical environment. So do people have access to affordable and healthy foods in their community? Do people have access to exercise opportunities, or do people have access to recreational facilities? And so just working on those types of things and working with our community partners and in city planning to allow for more of those resources to come into communities so that being healthy becomes more attainable for individuals.
Right. You've got goals that you can shoot for, that's for sure.
Absolutely.
Teresa, thank you for coming in tonight. We appreciate it. We're out of time, but we've got a lot more information for you on the web at woodtv.com.
Thank you.